Hi, my name is Dr. Alif Musaji, also known as the Smiling Dentist, and today I want to talk to you about one of my favorite parts of dentistry, which is dental implant treatment. Today I want to talk to you about the immediate tooth. It's one of my favorite treatments to do. It's a treatment where we're able to remove somebody's tooth if it's infected or broken, and not only place an implant, but to immediately put the tooth on as well. Welcome to the immediate tooth. What I always start with is obviously we need to take a CT scan, and we need to take a digital scan as well, an intraoral scan, so that we can merge that information. Now with that information, the kind of things I'm looking at, most importantly, are if there is a good and favorable root anatomy. One of the times which will upset this treatment is if you have a very big root. If you have a big root that you're going to take out, you'll be left with a very big socket, and you'll find that there's nowhere for your implant to be able to be placed so that you get the adequate primary stability, if you like, the bite, that will allow you the strength to put a tooth onto it straight away. So it's a very important distinction, and one that you can work out at the very start whether this is going to be an appropriate case or not. Let's say the morphology does allow you to place the implant, then one of the things I always do for my treatment is to make a guide. And the reason I want to do that is I want to make sure that when I have planned that the implant needs to go into a certain place, I would like my hand held a little bit so that on the day of surgery, I've got a guide, I've got a tool that's going to make me and force me to put the implant into that correct position. Now, once we've got the implant in, then the next step is that we need to be able to make the tooth. Now, most of you guys who know me know that we have CEREC at the practice, and this has been one of the most important and beautiful things that we've been able to do with the CEREC. Not just teeth for crowns on teeth, but also crowns for these immediate provisionals. So what we do is once we've placed the implant, we can scan the area and then design and make a restoration immediately. Now, this is nice because the patient ends up with a tooth. It's a lovely service that we can give to our patients. But the real game changer for me has been how, if you take the tooth out, you now still have an imprint of where that soft tissue is, the gum around the tooth. And what you're able to do when you scan is to capture that information and then recreate it in the crown, the implant temporary crown that you make there and then. So you can shape not only the supragingival portion to look like the tooth before, but you can carefully shape the subgingival portion as well, so that it supports the soft tissue and actually encourages a little bit more growth, so you get a better thickness of the tissue there. And essentially what you're able to do then is to take a tooth out and put a tooth back in there and then. I find that you end up stabilizing the soft tissue profile really beautifully, and then when you move from your provisional restoration, which of course you must consider that you will make it lighter in contact so that we're not loading the implant before it has adequate biological stability. But it means that then when you remove the provisional, let's say 3 months later, and change it for the permanent crown, the gum will always be supported in the same way, and you really do end up with very nice predictable results by doing this treatment. And I've been really happy with some of the cases I've been able to treat, and I feel really confident about doing a nice treatment for patients, which before I would feel very uneasy as to whether we would get a good result for them or not. I hope this has been an interesting topic for you to learn about, and I look forward to seeing you again soon. And please don't forget to like, subscribe,